Welcome. This is Jean Eaton of Information Managers. It is my honor and pleasure to be with you today at Practice Management Nuggets. This is a weekly interview series with practice managers, healthcare providers, or trusted vendors who support healthcare practices. Our topics help primary care practice managers, healthcare providers, and owners to implement, maintain, or improve their business and practice administration so that healthcare providers can focus on providing quality healthcare services. I am your host, Jean Eaton, the Practice Management Mentor with Information Managers. Our podcast today is sponsored by the Hiring Employees Resource Package. You can pick up your resource package for employee job descriptions, interview questions, performance appraisals, and even exit evaluations when you have your staff rotating in your office. So follow us on informationmanagers.ca, hiring templates. Today, I am delighted that we have Shawna Briscoe on our team in our virtual offices here in Edmonton. Shawna has been with Canada Medical for 11 years. Prior to that, she worked in medical offices such as the OB/GYN offices and chiropractic offices. Shawna currently has a great interest in reprocessing and making sure our buying customers are compliant with current CPSA and Alberta Health Services regulations by offering free training and clinic walkthroughs. She encourages listeners to consider Canada Medical as your personal assistant to medical supplies, as our staff are fully trained with the proper use of Health Canada regulated products. Shawna, I am delighted to have you with us today, and thank you for joining us in our offices.
I'm delighted to be here, Jean. Thank you for having me.
Shawna, you and I have met through the Canadian Medical Association meetings, and we have had some shared comments and some shared clients to find out more about the great things that you're doing at Canada Medical and the new initiatives that you've got started there. And whether or not you're our new clinic or our established practice, you need medical office supplies and medical equipment supplies, and we need to know how to use them. And your staff rotates, and we need to make sure that we're keeping them up to date. So we have a lot of things to talk about, but I'd like to hear from you about how you got to Canada Medical, and what is your number one tip for clinic managers and practice managers about medical office equipment?
Well, Jean, our I guess not our mantra, but something that we like to do with Canada Medical is actually help healthcare professionals reduce their cost of medical supplies without impacting service, which is obviously important. With today's spiraling costs of healthcare, it is a critical issue for most institutions. We at Canada Medical strive to be the best at understanding and satisfying your needs in the medical supply industry. And if I had to offer one tip, I think that would be to choose the right supplier, of course.
That's a big start,
absolutely.
Yes.
If they're a good fit with you, your inventory management will be seamless.
Okay, so having a medical supplier is a good fit. And what would be your criteria for selecting a medical supplier? If you're a brand new clinic and you didn't know where to get started from, what do you think makes a difference? What can Canada Medical offer that's perhaps different than other suppliers?
We actually take the time out to come and meet with you and sit down with you and work through things with you. It's very obviously stressful at the beginning of opening a new clinic. Where do I start? Where do I go? Because we've been doing this, and myself personally, for such a long time, we will actually walk you through and hold your hand if necessary to get everything done on your schedule, of course.
Okay. So I've worked with many practices that are just getting started. And when you've got a brand new practice and you're just getting started, there are so many things to know. And sometimes we get into a bit of a rut or a concern that we don't know everything that we know that we're supposed to know, and we don't know where to get started.
Exactly.
How can you help us get over that hurdle of not doing something because we don't know where our next step is?
Absolutely. As I was mentioning, we'd book an appointment to kind of sit down with you, go over what are you looking for in a supplier? What are your goals for your clinic? What type of clinic are you opening? There's a really poignant questions to ask, obviously, so we can get more information out of you so that we can help service you better.
Okay. So as we go through our chat today with Shawna, I wanted to remind you about two things. One, that we have a chat button on your screen. So on the bottom right-hand corner of your screen, you should be able to see that chat button. And you can send us questions throughout the chat if you joined us live on YouTube. And we'll try to respond to your questions during our interview. If you are on our website, you can enter the questions in the bottom of the chat button on their screen, and those will be sent to us by email, and we will reply back to you by email. So also wanted to let you know that on our website, you have the opportunity to download the Learning Resources Guide. So the Learning Resources Guide is a way that you can follow along with our conversation, to record your notes, and to get that valuable contact information from Shawna. So we'll replay our slides with Shawna for the contact information, but you can follow Shawna at canadamedical.net and be able to get connected with Shawna after the seminar today. So Shawna, we're going to talk about a couple of different things here. And the first one is our question about medical equipment supplies. So what does that include?
Well, at Canada medical equipment can actually mean a variety of things. It's such a huge, all-encompassing type of scenario. Basically, I tell new customers that we sell everything you need for your medical clinic except for the computers. So everything from what you think would be just disposables, paper towel dispensers, change tables for the babies, as all the way up to exam beds, power tables, sterilization room equipment.
Okay. So everything but except computers.
Basically.
That's a lot.
It is. A lot of our medical equipment requires a computer to use it. So you obviously, modern medical clinics obviously are going to have computers. A lot of people are going paperless, but we sell everything from here to there.
Okay. So where do we get started? We've got our new practice. Where do we get started? How do we know what we need to get?
As you meet with me.
Okay.
We'll ask you, what type of clinic are you opening? Certain clinics may offer special equipment, for example, bariatrics. They may require power tables. Workflow is always important. We can work with you to establish a well laid out clinic. If you're still in your drafting phase, there are special requirements that we can bring to your attention. Example, is it an OBGYN office? Is there going to be sufficient room for strollers? Do you have a sterilization room? Do you have a proper sink and the proper layouts? Are you wheelchair accessible? What type of barrier-free rooms do you have? Are the doors going to be wide enough for wheelchairs? These are questions that we're going to ask to help get information to you to decide on what type of equipment to supply you. Okay.
So it sounds like you have a lot of information to be able to share with us. When you're starting a new clinic, when's the best time to actually engage you? When should we start talking with you?
As soon as you know that you're going to start a new clinic is generally when I would suggest. There's no such thing as the sooner the better with us. As soon as you know, we're happy to help you out. Sometimes people contact us too late, and I could have pointed them and saved them so much time with finding those answers for them and getting their equipment to them in a timely fashion.
Okay, so this isn't, we don't give you a phone call a week before we're ready to open. When we're still building the walls and putting in plumbing?
Preferably don't call us the week of your open. We will be happy to accommodate you, and we have done that in the past because, of course, there's unforeseen circumstances. But yeah, as soon as you know, we're actually really happy to help you out because the longer you have to plan, the longer we have to accommodate.
Okay. So you're able to help us with some of the floor plan, making sure that we've got some workflow issues, plumbing issues, and sterilization room types of things.
Exactly. Yes.
Okay. All right. So how do we, do you have a shopping list that we get started with?
I do actually have a checklist. Again, it does seem like a daunting task at first because it is a couple of pages long. But this would be something that I would ask you the proper questions to kind of eliminate some of those equipment because that might not be valid for your type of institution. So again, just knowing, I know to ask the proper questions to eliminate a lot of your time and hassle.
Okay. So to help us figure out what type of practice that we're providing so you can give us the right equipment.
Exactly.
So the types of questions that we might be asking, what type of practice do you have? Are you going to have a treatment room? What other questions like that would we need to be prepared for?
As far as new clinic goes, basically once I know if you have a specialist in your clinic, then we can look again long term. That specialist might require a sterilization room, even though you were initially just thinking of going disposables at first. If you're planning down the road to have additional associates in your medical practice, it's probably a great idea to plan for that now at the building stage instead of having to renovate down the road and incur those costs later. It's probably more lucrative just to pay it all right now.
Okay, so while the walls are still open, it's easier to make renovations.
It is, absolutely.
Okay, so even if you're a general practice and you want to have a specialist come in on a occasional type of basis at some point down the road, you need to make sure that you've got the right physical space for that specialist, or you're not going to be able to recruit them.
Exactly. Yeah. Okay. It definitely opens doors to have that space and options available.
All right. So we've talked about central processing. What is CPSA, and what are the regulations? What are the things that we need to know about processing?
Certainly. So again, we'd be happy to sit down and explain a lot more in depth with you, but CPSA have extensive regulations. We'll help you comply with the legislations. For example, Jean, did you know in July 2010, Alberta Occupational Health and Safety has mandated the use of safety engineered needles in physician offices? Failure to comply may result in a fine of up to $500,000. The legislation also states that there should be sharps containers in each room where injections are done. In accordance with the Alberta Health Services standards, they are strict with the proper use of medical products. You may have been using the wrong type of gloves and not even knowing it. We will help you choose the right items to meet the current standards.
Okay. And I did know about that new sharps requirement because I saw that on your Facebook feed.
Yes, our Facebook is fantastic when it comes to a place to go for information. Where, again, if we know legislation, we're going to put it up for you because information is power. Our Facebook page is a great place to visit on a regular basis and to see our promotions and what products we offer that month.
All right. And the Facebook page, I was really impressed. It had lots of very good resources and links about the updates in the legislation and how that it might affect you. And so a really great source of information. I was very impressed with that.
Thank you so much. We try hard to stay on top of everything and updating it regularly.
Okay. So Facebook is one way to be able to keep in touch with you. What are the other ways to keep in touch with you, Shawna?
Well, obviously, email is a great way. Phoning me, I'm always available on my cell phone. And if not, you can call the office if you need more immediate attention. We have multiple ways to track me down.
Okay. All right. So we've talked a little bit about the CPSA regulations. Anything in particular that we need to know about Alberta Health Services regulations, or
how much time do we have today? Again, we'd be happy to sit down and show your staff and maybe even build some type of training binder to make sure everybody's up to date on current legislations, because the last thing you want to hear from your staff is, well, I didn't know. So any type of written documentation would be really vital to a clinic.
Okay. So we need to know about central processing and re-sterilization. We need to know what products that we need to order.
Exactly.
And you've got a list to help us with that, so we know what we need to order.
Exactly.
Okay. We need to keep current with training with our staff.
Yes.
So when we're planning that new clinic, we need to make sure that we've got some training time slotted for medical equipment supplies, in addition to our computers and our EMRs and everything else. So if you were to live in a perfect world and we were going to train a new clinic with new staff before the clinic opens, what type of timeline would you suggest would be a good thing for timeline for training new staff?
I would generally slot a few hours. Doesn't have to be consecutively. It could be over the week if that works better for your time management. But yeah, there's always questions that follow along with all the training. So we'd like to answer everybody's questions because we'd like to walk away with everybody knowing all the current legislations. It is vital in the clinic to constantly update your protocols and legislations as they change continuously. So we'd hate anyone to be left in the dust with the, well, I didn't know.
Right.
Unfortunately, that doesn't quite help the physician pass his inspections, that I don't know.
Okay, so the inspections is another point. It's one thing to be able to get the equipment, then you have to do the training, but you have to get some inspection. Where does that fit in the timeline?
Basically, they will contact you when they have you kind of in their roster. However, you don't know when that's going to happen. So again, it's great to be on top of that regularly and always updating your, let's say, office protocol binders and whatnot. Then that way, when you do get your letter of notification that they're coming next week, it's not a mad panic for 5 days to get everything all accumulated. You've already done it and everybody's trained and they're much more relaxed.
Okay. So if you have a CSR room, so if you're doing central processing, sterile processing, you need to have an inspection. If you're going with disposables, is there any type of inspection requirements?
Well, not currently. However, the college is revising that at this time. They're actually going to probably shortly implement a clinic walkthrough based on just general office environment. And again, they will go through a lot of the products that I had just mentioned. Are they proper? Should you be using that for that procedure? Can you prove to me that you're disposing this instrument after use? And if you have it in writing, then that's much more helpful to the staff.
Okay. So in Alberta, that process for a walkthrough, if you're not using CSR, isn't in place yet, but you see it coming soon.
Yes, he on the college's website, it shows that he's revising the college prep office environment inspection. So I can foresee it in the future coming down the pipeline, right. Everyone.
And other jurisdictions, other provinces, listeners from other provinces who may be participating today need to be aware to ask those questions for their jurisdiction.
Absolutely. And I'm sure they can go to their own provincial's college website. I've kind of checked them out all through Canada. Everybody has really good college websites with great information on these type of issues.
Okay, so if we're looking on a website, what are the keywords that we're looking for?
Infection prevention and control. Okay. Basically, a lot of things will be covered under those words.
All right, so infection prevention, control, and sterile processing, reprocessing?
Reprocessing is the current proper word, I guess.
Okay, so that's the current words we should be looking at. Okay. Medical supplies inventory. So whether or not you're a new clinic or a clinic that's been in practice for a while, you're probably going to have to replace and keep things up to date as far as your equipment. So Canada Medical has some great new initiatives about helping with some inventory control. Tell us about it.
Sure. We understand the needs of clinic managers and physicians to have systems in place to deal with not only ordering, but also with controlling access, reviewing, and reconciling purchases made. Whether you're managing a single or a multi-office clinic, Canada Medical offers 24/7 seamless and customizable access to your account to ensure you concentrate on what's really important, the health of your patients. For instance, an online account with us, you'll be able to configure your account for any scenario you may have, whether it's a multiple location or a one ship to address, etc. You can view purchase history. You can check your outstanding account balances, customize order lists, show invoice history. Our website offers a great inventory management program as well. Let's say you notice your clinic has been using more gloves than usual, and you can't kind of figure out why. A great thing you can do is log into our website, pick the date range, let's say the last few months, enter the item number of your glove, and submit. It will show you every time you purchase that glove within that date range. And then that way you can go back to your staff and kind of do your own internal investigations as to why you've been going through that many gloves. We can give a clinic manager the authority to review the orders. They can log into the account, view the order, and then just submit it themselves if it looks good. We can also even offer you more economical choices. We can work with you to see if we can save your clinic money by switching brands or offering smaller quantity packaging.
Okay. So it sounds like we could delegate within the clinic to different people who work with maybe assigned to one doctor or to one type of a procedure. They can go in and update their inventory list, but not have the authority to actually purchase. Somebody else with the purchase decision can go in and approve or not approve and put the purchase order through.
That is absolutely correct.
Okay. So that's a really great way to be able to delegate, make sure the right people are responsible for those actions, and yet you still have somebody with signing authority and purchasing authority that has that accountability.
Exactly. And that's a great way to keep control over the supplies. You don't have someone ordering expensive products or, oh, I like this color better kind of thing. You've kind of went in, pre-established your list, so then they work within certain limits.
Okay. One of the things that we've talked about with one of our previous guests about making sure that we have some accountability as far as some fiscal responsibility. So it's one thing to make sure that we've ordered the supplies, that we have somebody else that has the fiscal authority to write the order.
Mm-hmm.
But when you're receiving the supplies and receiving the inventories, what are your suggestions about how the clinic receives the inventory so that we verify that we did get what we thought we ordered, and that it's been received in the clinic and not in somebody's purse or car, or hasn't walked away?
No, exactly. When you receive your order, we basically, first thing we'll tell you is please check for how many boxes you're signing. A lot of times the Purelator driver will just hand you the tablet and you just sign your name. Didn't even look up for a second, you're on the phone. How many boxes did you just sign for? Because if you sign that you received 10, but you only got 8, your signature's there, and then you're kind of on the hook for that, all those boxes you received. Another thing, when our orders go out, they come with a packing list. So make sure that you're opening your packing list, you've gone through your list and checked off that you've received everything, and open every box before you call us, because a lot of times we'll pack smaller items in a little box together, and even though it might say that it's 3M steri strips on it, in fact there's other products mixed in there. So just make sure you open every box.
Okay. That's an important part, to make sure that we've received what we thought we received.
Yes.
So that, if there are any, I can't find this. Oh, I ordered the wrong thing. And then you can get that part of it looked at.
Mm-hmm.
But also part of that fiscal responsibility and security, to make sure that you've got those supplies and that they haven't been misappropriated, hasn't been not delivered in error, or
correct.
We've got lots of things that could go wrong. This is the ideal time to make sure that you've got it looked after.
You bet, you're right on that point of delivery, and that way you're not knowing that someone came out and grabbed a box before you've had a chance to check it off because, we were all out and we needed it right away for the surgery.
Yeah, exactly. Okay, so we have taken a look at our supplies list. We know that we can now keep things on track as far as our regulations, and some new things that are coming up, and we'll follow you on Facebook so you can let us know about those things that are new and different. We've taken a look at some timelines, some inventory supplies. What else are we missing, Shawna? What else?
How about some questions to ask a potential vendor?
Perfect, thank you. How to select a vendor.
Absolutely. A lot of times people forget, I'm just going to go with this company because I Googled them. But really, it's almost an interview process. If you were going to work this closely with somebody and you entrust them to place your orders and deal with your accounting, you want to make sure you really kind of interview them and ask some vital questions. Some questions I kind of pointed out would be to ask a potential vendor, do you have an active Health Canada Medical Establishment license? Basically what that is, it's a regulatory body to ensure that medical devices are approved to be sold and therefore used in Canada. Additionally on that, do they have a Health Canada Drug Establishment license? Basically, we have to temperature manage our logs for our drugs, maintaining certain temperature and storage parameters. In the event that there's a recall procedure, there's certain protocols that we have to deal with to make sure that those drugs aren't distributed to customers.
After past due dates?
Exactly. How often will you see a rep? What type of support do they offer, and if there's a defective product? For example, we're a licensed Welch Allen distributor, so we can go directly to them if there's any warranty issues, as opposed to sub-dealers that have to go through multiple channels.
Okay.
Some other questions would be, what's your turnaround time for deliveries, your back order rates? On top of 99% of our orders going out complete, if there is a back order, we will call and offer you a substitute. If there's no substitute available, we'll give you an approximate date so you can book your appointments accordingly. What are your order placing options? We have online, email, fax, phone. What type of quantities do you sell in? Smaller clinics might not use an entire case, and we'd hate for it to expire on them.
Okay, so those are good questions, and it's a good point. When you select a company for your supplies, and you're getting the services that you want out of them, that's a long-term relationship. So put some effort in the front end to make sure that you're selecting the right client for, the turnaround. Have do they have most of the products that you need? Do they have all of the products that you need?
Mhm.
What other training services and how are they going to be able to keep in touch with you? Are key important parts. It's an interview process.
It absolutely is.
Yeah.
Mhm.
Okay, that's an important part. Thank you. For a clinic that's been in practice for a while, and what types of things would you suggest that they take a look at on a every once in a while basis, maybe an annual basis? They haven't looked at the medical equipment supplies process for a while. They just get the same old, and things seem to be going okay. But what are the tips of things that they might need to do now?
Basically, it's a good thing that your rep kind of gets in touch with you on a regular basis. I'm always trying to keep my customers informed on what the newest not only product is out there, but we have more economical products coming in on a regular basis. Everything's competitive, and with our current exchange rate, we kind of really looked at, is there more local vendors that we can deal with to kind of pass that savings on to the customer? So we're always going in and maybe offering non-brand name products, again, to save the clinic money. So that's something you can do with an already established clinic.
Okay. And I guess we have a need to be able to go back and check on a regular basis, make sure our products haven't expired, clean out the storage cabinets.
Exactly. That's something that I would work with you on, basically how to make some type of inventory rotation binder to kind of teach your staff to make sure they're using the oldest products first and not always just picking from the front.
Okay. So there are some things that we can do to fine tune our process.
Isn't there always?
There always is. And maybe there's an opportunity to take a look at our order supply list, because we've always bought it this way.
Right.
Is there a newer, better product, or is there a generic product that's come out that's less expensive? Is there a different way that we can purchase the quantities that we can maximize the economics and scales?
You got it. For example, one time I had a clinic that was cleaning their patient oxygen masks. So the product they were using to clean their patient oxygen mask, plus you have to log it, you have to buy the strips. So the time they were taking to clean the mask, plus with the incurred cost of the cleaner, it was actually cheaper to dispose the mask each time at 99 cents per patient, as opposed to all that extra work. So I'll bring certain things like that to their attention, cost savings as well as time savings.
Okay. So it sounds like we have an opportunity for a maintenance checkup.
Yeah, that's a great name for it.
Okay. So if you've been in practice for a while, you've been doing the same old, maybe it's time for a maintenance checkup and see where you can improve your practices. Make sure that you've taken the time to perhaps refresh your training, refresh your documenting, find out what the new and upcoming legislation is, so that you could be prepared for it and you're not scrambling at that last minute.
That's correct. That's absolutely correct. And that would be something that we could do with you on an annual basis. Just pop by and check to make sure you're getting the best value out of your products and the best value out of your staff's time.
Right. Which is also very important. Okay. Shawna, we are about out of time. Is there anything burning that we haven't touched on that you want to make sure that we talk about?
Also, basically timelines for new clinics to make sure not only contacting us as soon as you know would be preferable, but other things that you might not know that we do. We actually do clinic cabinetry as well.
Oh.
So again, everything except for the computers.
Okay, that's good.
We usually generally want you to work with us. We can actually, we work really close with our Bid-to-Mark partners, and we can actually get you free drawings for cabinetry. However, when you do order those are made to order product, obviously. So do allow 6 weeks for delivery time, as well as with your exam bed upholstery. There's not as many upholstery colors as there is paint colors out there in the world. So it's almost a good idea to pick your medical upholstery colors before your paint swatches and your carpet swatches, because it's way easier to match those to a few upholstery colors. And again, make sure, depending on how many exam rooms you have, you want to make sure that we have enough stock for your opening date. So it's, again, good idea to maybe just order those 6 weeks in advance, just to give yourself that cushion.
I never would have thought about matching colors.
Yeah, and I think that's more of a girl thing with decorating. Yeah, and that just goes back to my, it's just easier to, there's so many different paint colors at Home Depot than there is, I think we only have several medical upholstery colors.
Okay, it never even crossed my mind.
Well, I'm glad I brought something new to the table.
You did. You have brought lots of new things for us, Shawna. You've helped us with some timelines, some legislation information that we need to make sure that we are aware of. Some great ways to be able to keep in contact with you. The opportunities that you provide as far as training and keeping our information current. Questions that we need to ask our vendors to make sure that we're selecting the right vendors.
Mm-hmm.
It's a long-term relationship, so let's make sure that we've selected the right ones, and you've given us some suggestions for that interview process. Also an opportunity to be able to do a maintenance review. How are we doing now? What can we do to improve? How can we continue to improve our training and our staffing? And make sure that we're compliant and providing great services for our patients, even right down to the cover slots.
Exactly.
Shawna, I am delighted that you have joined us today. Thank you very much. You've been a wealth of information. I appreciate that.
Well, thank you so much for having me, Gina. It's been a pleasure.
Okay. I wanted to remind you that we have recently celebrated National Receptionist Day. That was just yesterday, so if you missed it, it's okay. You can still work with your receptionist, your managers of first impressions. I like that saying. So Nelson Scott is offering a tip a day for staff recognition money, and he has lots of great tips that you can use in May and throughout the year to be able to keep yourself engaged with your staff and to be able to keep your employee engagement and your patient satisfaction. Practice Managements, we're here just about every Thursday. You can join us every week on our website, and if you'd like to get a weekly email reminder about our upcoming guests, you can just sign up for our newsletter for Practice Management Nuggets weekly reminder list. We have upcoming replays in May, Employee Engagement with Paula McLean, and Corporate Security with Dave Rodwell. So these are replays of our interviews that we've done with these guests over the last year, and they're in high demand. So we have them again here for the month of May. Sign up for membership for the Information Managers Network, and you can join us for our question and answer, our weekly opportunity to have open mic with me to answer your questions, and you can send us your questions at any time by email. Let's stay connected. You can join us for our newsletters, be a member of Information Managers Network. You can follow us on LinkedIn and on Twitter, and we're also on Facebook, so I'll be tickled pink if you can join us there and like us on Facebook. Our podcasts are now available on YouTube and on Stitcher Podcasts and on iTunes. This is Jean Eaton, your practice management mentor with Information Managers. It's been delighted to have you with us, and I ask you to stay tuned.